you are tired of how your dentures look, and more importantly, how your dentures feel and perform, the Center for Neuromuscular Dentistry may have your answer.
Hi, I'm Dr. Charles.
And I'm Dr. Ina.
In 1958, Dr. Bernard Jenkelson of Seattle, Washington, introduced the neuromuscular philosophy into the measurement, fabrication, and delivery of dentures. One of our instructors and mentors from the LV Institute for Advanced Dental Studies is Dr. Jenkelson's son, Dr. Robert Jenkelson, to whom the torch was passed by his father, and who is considered one of the foremost authorities on neuromuscular dentures in the world.
The next few minutes, you will see an excerpt from the dental training tape conducted by Dr. Jenkelson.
The edentulous denture patient is often the most aesthetically and functionally compromised of all the patients that we see in our practice. These patients require the optimal in the doctor's skill, knowledge, and state-of-the-art technology before they can be predictably restored to optimal aesthetics and function. It is important, before you begin the prosthetic procedure, that the patient's expectations of aesthetic and functional success are realistic within the context of your clinical findings. Before undertaking any prosthetic procedures, you should obtain a complete medical and dental history that includes the reasons that the patient originally lost their teeth. It includes the experience that the patient has had with their past prostheses, and it should include the chief complaint and the future expectations for the prosthesis that the patient has. The effect of inadequate denture support resulting in premature aging can be seen by the thin upper lip, the deep angular creasing at the corners of the mouth, the accentuation of the length of the chin and the nose, and when the patient smiles, you see that the upper denture is set very straight, not conforming to the smooth curvature of the patient's lower lip, resulting in a very unnatural appearance. You can also see that there is a disproportionate amount of upper denture showing with little or no lower denture appearing.
Because the muscles controlling the jaw are subconsciously programmed by the brain, most individuals have difficulty consciously reaching a truly relaxed state. To help your muscles reach this relaxed state, a medical device called a myometer is used to deliver gentle electrical stimulation to your muscles. This mild stimulation is delivered through adhesive patch electrodes attached over specific nerve sites that control certain muscle groups. This stimulus will cause your facial and jaw muscles to twitch or pulse once every 1.5 seconds. After about 40 minutes, this electrically induced excursus will allow your muscles to overcome their programming and go to a relaxed state. After relaxing your muscles to their natural position, your impressions are taken using a special sapphire compound. You'll notice that the finished impressions have a small tension handle used to test the fit and retention of the impression. As you see, the impressions have tremendous natural retention. In fact, many of our patients never require denture adhesive products. With traditional dentures, the dentist arbitrarily establishes the patient's bite. With neuromuscular dentures, we use very sophisticated medical and dental equipment to help us make that decision. Using jaw tracking and surface electromyography, we are able to locate within 1/10 of a millimeter the exact point your lower jaw should be positioned for maximum harmony between your jaw, your muscles, and your joints. To achieve this unprecedented precision, a series of tests are performed. The Case 7, a three-dimensional diagnostic computer, then analyzes the data generated by these tests. We need to know where your bite is now, which muscles are having impact on your programmed bite, and most importantly, where your physiological bite should be. After your correct bite position is determined, The myometer is used again to relax your muscles. At this point, everything comes together and your bite registration is recorded. When your new dentures are completed, we once again use this ever so important myometer for final precision adjustments. This eliminates the patient inadvertently controlling their own bite.
As you saw in this video, many of the techniques used are entirely different from the fabrication of traditional dentures. Now, let's take a look at the results.
One of the greatest satisfaction in dentistry is restoration of the patient to full aesthetics and function. As we look at the patient with the new denture, the chin and the nose have been shortened and de-accentuated. The upper lip is full, the lower lip is full. There is nice lip distribution. There is a decrease in the angular creasing or chelosis, a decrease in the depth of the mentalis crease because of the support of the lower denture. There's a very nice turn of the upper lip that is now supported by the upper teeth. When the patient smiles, we see that the lip and the incisal curvature are coincident. When the patient says 444, the upper maxillary incisors just touch the wet-dry border of the lip. In profile, the chin is de-accentuated, the length of the nose is de-accentuated. There's a very nice curvature of the upper lip. The facial profile is full and pleasing. When the patient smiles, it looks very natural. You can see the cuspid is the cornerstone of the support of the upper smile, and also in profile, the curvature of the upper incisors conforms to the curvature of the lower lip. Again, when the patient smiles widely, we see a very nice, pleasing harmony between the lips and the teeth. The ability to dramatically restore function and aesthetics in the badly compromised edentulous patient requires state-of-the-art techniques and instrumentation. Relaxing the patient with the myomonitor before muscle trimming the denture periphery allows full, precise molding of the denture borders with the myomonitor. The myomonitor and the K6i allow unprecedented precision and predictability for identification of the most physiologic bite along the patient's neuromuscular path of isotonic closure. When the vertical dimension is properly restored, optimal function and aesthetics are assured every time.
We cannot emphasize enough that with the techniques and instrumentation we now use, the neuromuscular dentures are quite simply the best dentures in both functionability and aesthetics.
Call us for a complimentary consultation and see how neuromuscular dentures can improve your overall life.